Talking about a little bit some shoulder pain. In particular, we're going to talk about some anterior shoulder pain, or pain that occurs in the front of the shoulder, especially with motions that involve a lot of either pressing or overhead motions, right? So a lot of times with anterior shoulder pain, that biceps tendon is a little bit inflamed. Sometimes we get some impingement of the supraspinatus tendon, which runs this way. But to treat this, we can use a technique called ART. We actually start treating in the posterior of the shoulder here in the office. The reason for that being is a lot of times we get a lot of junkiness or stiffness in the back of the shoulder here that causes the shoulder kind of roll forward and out of position. And we lose that congruency in the socket between the humerus and the glenoid cavity, right? So what we can do is by relaxing this posterior musculature, changing the tone back here, we can let the shoulder sit back in the socket and help improve that rotation through the shoulder. So the motion we're going to use here with ART, active release technique, is going to have the shoulder or the patient lift their shoulder out to the side. They're going to excellently rotate the arm. I'm going to find a little trigger point in through here, usually somewhere in between the infraspinatus, the teres minor, kind of almost on the posterior capsule part of the shoulder here. I'm going to have them rotate their arm all the way down in internal rotation. I'm looking here, I'm looking to not see that shoulder shoot forward in the socket. I'm looking for a nice congruent rotation here in the shoulder or in the actual joint itself, and then she's going to bring the arm across her body as I hold pressure here, using that right arm as needed to pull the arm across. Again, she's going to come on back and reset. She's going to rotate down in the internal rotation, bring her arm across as I hold pressure here, making sure that shoulder stays nice in the socket there. This pressure usually feels pretty intense, almost like a little bee sting in the posterior part of the shoulder there.